Okay, hey Lisa. Um,
Hey,
let's do this. We wanted to do a Facebook Live, I know, which is always fun, but for whatever reason, technology was not in our favor today, but that's all right. I have some really important questions to ask you, and I want to dive right in because I swear this is one of the hottest topics of conversation right now. So many people are talking about, whether or not they're going to try a GLP-1 weight loss medication or any weight loss medication. It's
right.
January. People are thinking about their health goals anyhow. And then this is huge. And so many people have their own ideas, a lot of misconceptions, a lot of fears. And so I just thought this would be a really great conversation because you are a nurse practitioner, an expert in the field. You have your own business. You're coaching people through this process all the time. And I want to be able to just get some little truth nuggets so that we can be more informed, whether we're considering it or not, or maybe we have a loved one who's considering doing this. We want to be supportive of them. I think that it's just so good to get this information. It is not going away. Am I wrong?
You're not exactly right.
Okay, so tell me kind of how you got into your business and why you are offering this service.
Okay. Like you said, I'm a nurse practitioner, so my background is in emergency medicine. Through my adult life, I kind of struggled with weight issues, always worked out, tried to eat healthy. Those were not things that were instilled in me as a young child in my family. So got into it when I was older. After having three kids, wanted a little bit of help losing weight because I couldn't really get to where I wanted to get. And I heard about this medication. So I was like, well, I'll give it a try. And at the time, my insurance was covering it. It was $25 a month. It was great. And then, bam, pulled the rug right out from under me. So I was like, oh my goodness, like this medication is really doing wonders for me. So I started thinking about how I could get it for myself. And in doing that, I thought that I could also help other people who didn't have the means to get it through their insurance anymore, or who would have to pay, $1,200 a month to get this medication that has really become life changing for a lot of people. And so that's how I started. Virtual Vitality is the name of the business, and it's really taken off.
Wow. Okay. So I coach people with healthy lifestyle. I mean, you know that that's important, right? I know that's you're a big fan of exercise, healthy eating, holistic living, really. And so the biggest question I get is like, am I a failure if I add a GLP-1 to my wellness plan? Or like, is there something wrong with me? Like, am I taking the easy way out?
Mhm.
I hear that a lot, and I try to make sure that people understand that my personal philosophy is if you come to me and you're taking depression medication or cholesterol or blood pressure lowering medication, anxiety meds, there's no judgment. You're coming to me with whatever health issues you have, and then we're going to plug you into healthy lifestyle habits that can help you to reduce the medication or get off the medication if need be. But also, or just support
Mhm.
your whole health in addition to the medication. So I think that's so important, and we need to make sure not to really treat this any differently. Um,
Mhm.
so when people come to me, it's really truly no judgment. Have you had that conversation with your patients a lot? And have you have experienced it personally? I'm just curious when, you said you're, someone who has used this medication yourself. So do you feel the judgment? Like, do you feel like people think it's cheating?
I did at first. I really didn't want anyone to know I was taking it. Kind of wanted to like hide the issue. They would be like, "Oh, how are you losing weight?" And I'd be like, "Oh, healthy eating. I'm working out," which I was, but I needed a little extra tool. But then once I became honest with myself and honest with other people, I realized how many other people were struggling with this issue, and that also are just looking for a little extra tool, like I was. Um, so people do still struggle with that. There is like a stigma with it, but there shouldn't be. Like you said, it's a tool. It's not a miracle medication. You still have to make the right choices, eat the right foods, do the right things. But it's definitely something that works and that patients are having great success with.
Yeah. Okay. So that's really good. So I think also another misconception is that people think this is just diabetes medication used in a different way. Can you sort of clarify that, how it's different from our traditional diabetes meds?
Yes. So it was originally, manufactured and made for diabetics.
Mhm.
It was insulin resistance, which diabetics have an issue with. A lot of people who struggle with weight and are overweight also have an issue with insulin resistance. A lot of it has to do with their diet, um, hereditary issues as well. So it also plays a role in the insulin resistance part, which helps your body, in turn helps you lose weight. But also it helps with the signaling in your brain, thoughts of hunger, thoughts of, okay, I'm full, also decreases gastric emptying time, that type of thing. So sure, diabetics use it and it's great for them, but it also has a lot of tools for people who just need that extra little um, mentality step, with the food. So, it takes away the food noise.
Mhm.
A lot of people who struggle with, overeating or that constant, like, there's cake in the kitchen. Are you going to take a bite? Are you going to eat the whole thing? The medication has a great role in that as well, and it's proven successful.
Mm. I think that's really, really important to mention. So, if someone has depression, we can't just say to them, well, cheer up, right? We
Right.
wouldn't do that. We know that's crazy. Like it's 2025. Now, maybe 25 years ago, we might have thought someone could just cheer up. So if someone's thinking there's cake in the kitchen and I can't say no to it, should we just say, just don't eat the cake? Just don't
Mhm.
think about cake. Is that really fair?
Yeah,
These are the thoughts that I'm thinking, and I think that a lot of people are thinking.
right.
Um,
And food is an addiction as well.
mm,
I struggled with it my whole life, so I can talk to patients from that standpoint. You know, with this medication, I can finally live without the food noise. I see what it's like to not be this constant nagging in my head about what I'm going to eat next or what I shouldn't eat and what I should eat and all of that. So it's definitely, has a mental aspect with it. And like you said, it's real, and some patients just need an extra little tool.
yeah. Okay, so the next big hot topic I think with this is the longevity of the medication results and long-term risk factors, that sort of thing. So I have really kind of been trained, I've been studying this a lot over the past couple of years, really the last year, that we need to make sure that at some point we're off ramping or we're weaning off of the medication. But I'm also hearing some things now that, maybe this is a tool that treats the biology of obesity. And so, maybe some people don't ever need to come off of this medication. They need to take it long term along with obviously healthy eating, healthy exercise, good lifestyle habits. Um, so what are your thoughts on that? Because I think there's a lot of confusion. Is it long term? Is it not? I mean, and I know from coaching, everybody's different. So what are your thoughts?
Um, it is very individualized. The GLP-1s, and like tirzepatide, it's a dual acting GIP and GLP. They have great anti-inflammatory properties. Studies are coming out now that it helps with, preventing cardiovascular disease. It helps with liver disease. There's a huge gamut of things that these medications help treat.
Mhm.
So for those patients, long-term use at a microdose, therapeutic dose is something that would be, advantage for them. Patients that just, want to lose 30 to 40 pounds that don't have any of these issues, um, I don't really think it would be a long-term, medication for them. If they want it to be, there haven't really been any risk factors associated with long-term use yet, but the medication hasn't been out that long for us to really say for sure.
Mhm. Sure.
A lot of patients who take the medication, lose their weight, get where they're at, they like to stay on a maintenance dose. Sometimes they go down to like the smallest dose, 2.5 milligrams of like tirzepatide, and they spread their dose out over 10 to 12 days. So they kind of use it as a little security blanket, is what I like to say.
Mhm.
Um, so there are potential for long term use, and then short term use is also very individualized.
Yeah. Okay. Well, that's good. So everybody's different. I mean, that's kind of what we thought. So that really does help. Um, all right. I know that people ask about side effects as well.
Mhm.
So, my thought is too, obesity is dangerous, right? We know
Mhm.
that it is a huge risk factor for lots of premature death and lots of disease. Diseases, heart disease, cancers, all the things. So, I always tell people, I'm like, we got to weigh risks and benefits. So,
Mhm.
how do you talk to people about that when they're like, what if there's risk factors? Should I do this? Just what are your thoughts?
Yeah. So common side effects: nausea, constipation, diarrhea, that type of thing. More severe side effects: pancreatitis. Let's see. Now I'm drawing a blank. Pancreatitis. um, so most people experience the nausea, constipation, diarrhea type of thing. There's two classes of GLPs right now: semaglutide, which is Ozempic. Those are more prone to the GI side effects, and then trizipatide is generally more well tolerated. Um, you can dose like very gradually, which is what I do with the compounding medication. You have the ability to do that when it's from direct from like the manufacturer and the pharmacy. They come in pre-filled syringes, so you can't really do that. So microdosing is an advantage to where if you do have some side effects, you can kind of titrate down and get the symptoms under control. Yeah, obesity and insulin resistance is a huge player in a lot of these chronic conditions. So if you get that under control, a lot of these other issues will hopefully subside. You'll be able to get off these chronic medications. So yeah, it's really a risk versus benefit. I personally would take my chance on the GLPs and trying to get a healthier lifestyle and that type of thing.
Okay. Yeah, I mean, we can probably close with that, but one thing that I tell people is if you want to live better, live longer, feel better, enjoy life more, you've got to have great habits in your physical body, but also thinking habits that are healthy in order to live full out and do your best. And so it, kind of almost has to be a team approach. You've got to work with your doctor. Some people need to work with a therapist, work with your health coach, make sure that you're solid in all aspects of wellness. And so, I want people to know that it's not just an all or nothing.
Right.
You're not just a medication taker or a healthy lifestyle practicer.
Mhm.
You can do a marriage of both, and that's okay if that's what works for you. And just that you need to make sure that you have communication with a team. Like, we don't have to all, even I coach lots of doctors and nurses. And like you know more about the human body and about health than I do, but you don't have to, um, even if you know it all, you don't have to do it all. Sometimes we need someone to guide us and someone to hold us accountable and to push us forward with our health. So, any last thoughts that you really want people to know? You really want people to see this and think about if they're considering this for themselves or if they have a loved one and they're like, oh, I don't know how much I feel about this.
Yeah, I definitely say to give it a shot. You can definitely try it for 1 month and see how your results are. The anti-inflammatory properties of the medication are super beneficial. A lot of patients that take it for weight loss end up saying that the anti-inflammatory issues with it are really what they stay on it for. I think that with your health coaching and the nutrition, and combined with this for patients that just can't really seem to reach the goals that they want, with just the dieting, healthy food choices, lifestyle alone, this is a good option for them.
Yeah. Okay. Gosh, and we didn't even like scratch the surface with protein and preventing sarcopenia and that sort of thing. But yes, we want you to eat well. We want you to take care of your muscles so that you can continue to have a great metabolism and that you can protect your structural body so you can continue to exercise and get stronger and stay healthy in the long run. So I know that you believe in that too. So that's just really important for anyone who's curious about that. You don't have to get skinny because you're losing body fat. You can still take measures to protect your lean muscle so that you don't end up atrophied,
Yeah.
and that all that healthy, beautiful muscle that we want to protect. So
Yeah.
Yeah. Cool. Okay, so I'll put your contact info in this post so that people can reach out if they want to have a conversation with you and just jump on the phone. And you treat patients all over the country, correct?
Correct. Yes.
Okay, you're just like me. You got them from coast to coast, and that's okay. So wherever people are, they can have that convo with you. And now they know you, so they can say, "Hey, I want to have this continued conversation." So thank you so much, Lisa. This has really, really been helpful, and thank you for just for being honest and encouraging. And I appreciate you.
Thank you very much.